Hello, my name is James Fitzgerald. This video is meant exclusively for my potential clients, new clients, and existing clients working in therapy with me. It is educational and informational in nature and not meant to be considered treatment. It is part of the outline and plan for your treatment, not the treatment itself. It is not meant to replace professional mental health care. It's the fourth video in a broader series of 8 videos. We've reached the halfway point, and so, after watching or listening to this video, I invite you to take a break before moving on to the next 4 videos. I'd like to continue bringing you through a comprehensive overview of my therapy program and treatment plan. In this video, we'll be looking at the assessment, outcome measures, and diagnosis stage of therapy. Please keep in mind, as you're watching this long video, no one is asked to complete all the assessments discussed here. The assessments you may be asked to complete will depend on the information you provide me during the preliminary intake and pre-screening assessment sessions. Assessment and diagnosis play a critical role in understanding your unique needs. We will work together to complete any necessary assessments and screenings, ensuring that we have a clear and accurate understanding of your challenges. This allows us to tailor your treatment plan even more precisely, ensuring that it addresses the specific issues you are facing. Assessment is crucial to understand where we're starting from to set a solid foundation for your treatment plan. To begin, you'll need to complete the portal activity titled Overview of Assessments. The outcome measures described here were available at the time this video was created. There may be new outcome measures that are not described here. I will make every effort to keep these videos current. Below is a discussion of each assessment tool mentioned. The Adverse Childhood Experiences Questionnaire assesses the impact of childhood trauma on your long-term health and wellness. It measures experiences such as abuse, neglect, family substance use, family's mental illness, and household dysfunction during childhood. Higher scores are associated with increased risks of mental health issues, substance abuse, and chronic health conditions. This assessment helps identify those who may benefit from person-centered, trauma-informed care and interventions that are aimed at addressing the long-term effects of childhood adversity. The ASRS version 1.1 Adult Attention Deficit Hyperactivity Disorder Self-Report Scale is a screening tool used to assess symptoms of attention deficit hyperactivity disorder in adults. It helps identify inattentiveness, hyperactivity, and impulsivity, which are the core symptoms of ADHD. This scale is useful for determining the need for further evaluation and treatment of ADHD, particularly in adults who may have been undiagnosed during childhood. The Audit Alcohol Use Disorders Identification Test is a widely used screening tool that assesses alcohol consumption, drinking behaviors, and related problems. It helps identify individuals with hazardous drinking patterns, alcohol dependence, or harmful alcohol use. This assessment is crucial for guiding interventions aimed at reducing alcohol-related harm and promoting healthier drinking habits. The AWARE Advanced Warning of Relapse Questionnaire is designed to identify early warning signs of relapse in individuals recovering from substance use disorders. It assesses changes in thoughts, feelings, and behaviors that may signal an increased risk of relapse. This tool is valuable for developing relapse prevention strategies and ensuring ongoing support for clients in recovery. The BBGS, Brief Biosocial Gambling Screen, is a quick screening tool used to identify individuals at risk for problem gambling. It assesses behaviors and thoughts associated with gambling addiction. Early identification of gambling problems allows for timely interventions, helping to prevent the escalation of gambling-related issues. The CAGE aid is a modified version of the CAGE questionnaire that includes questions about drug use in addition to alcohol. It is a brief screening tool used to identify potential substance use disorders. This assessment helps in recognizing clients who may require further evaluation and treatment for substance abuse. In the context of the CAGE 8 assessment, CAGE is an acronym representing 4 key questions used to screen for substance use disorders, particularly alcohol use disorder. The acronym stands for C, cut down. Have you ever felt you should cut down on your drinking or drug use? A, annoyed. Have people annoyed you by criticizing your drinking or drug use? G, guilty. Have you ever felt bad or guilty about your drinking or drug use? E, eye-opener. Have you ever had a drink or used drugs first thing in the morning to steady your nerves or to get rid of a hangover? An eye-opener. The aid part stands for adapted to include drugs, meaning that the questionnaire has been adapted to include questions about both alcohol and drug use. The CRAFT 2.1 plus N and the CRAFT plus N questionnaires are behavioral health screening tools for adolescents focusing on alcohol and drug use. It includes questions about the consequences of substance use and risky behaviors associated with it. The plus N refers to an additional section that screens for nicotine use. This tool is essential for early detection and intervention in adolescent substance use. The CSI 32 Couple Satisfaction Index 32 is a self-report measure used to assess relationship satisfaction in couples. It evaluates various aspects of the relationship, including communication, intimacy, and overall satisfaction. This assessment is useful in couples therapy for identifying areas of concern and tracking progress over time. The CSSRS Columbia Suicide Severity Rating Scale Screener Recent is a tool used to assess suicidal ideation and behavior. It helps identify individuals at risk of suicide by evaluating the severity and frequency of suicidal thoughts, plans, and attempts. This scale is crucial for ensuring client safety and guiding interventions aimed at preventing suicide. The DAS, Dyadic Adjustment Scale, is a measure of the quality and stability of relationships, often used in couples therapy. It assesses areas such as consensus, satisfaction, affectional expression, and cohesion between partners. The DAS helps therapists understand the dynamics of the couple's relationship and tailor interventions accordingly. The DESB Adult Brief Dissociative Experiences Scale Modified is a brief version of the Dissociative Experiences Scale designed to assess dissociative symptoms in adults. It measures experiences such as depersonalization, derealization, and amnesia. This assessment is important for identifying dissociative disorders and understanding how these symptoms may impact the client's daily life. The DES-2, Dissociative Experiences Scale 2, is a more comprehensive version of the DESB, providing a detailed assessment of dissociative symptoms. It is used to screen for dissociative disorders and to understand the extent and nature of dissociative experiences in clients. This scale is often used in cases where dissociation may play a significant role in the client's mental health issues. The EAT-26 Eating Attitudes Test is a self-report measure used to assess symptoms and concerns characteristic of eating disorders. It evaluates attitudes toward eating, dieting behaviors, and body image. This assessment helps identify individuals who may be at risk for anorexia nervosa, bulimia nervosa, or other eating disorders, guiding further evaluation and treatment. The EPDS, Edinburgh Postnatal Depression Scale, is a screening tool used to identify symptoms of depression in women during the postpartum period. It assesses emotional well-being and identifies signs of postnatal depression. Early detection through the EPDS allows for timely intervention and support for new mothers experiencing depression. The FTND, Fagerström Test for Nicotine Dependence, is a widely used assessment to determine the level of nicotine dependence in individuals who use tobacco. It measures the intensity of physical addiction to nicotine and helps in planning smoking cessation interventions. This tool is essential for guiding treatment strategies to help clients quit smoking. The GAD-7, Generalized Anxiety Disorder 7, is a brief self-report scale used to identify symptoms of generalized anxiety disorder. It assesses the severity of anxiety symptoms such as excessive worry, restlessness, and irritability. The GAD-7 is valuable for diagnosing anxiety disorders and monitoring the effectiveness of treatment. The LEC-5, Life Events Checklist for DSM-5, is a screening tool used to assess exposure to potentially traumatic events that may lead to post-traumatic stress disorder, PTSD. It helps identify events such as accidents, assaults, and disasters that the client may have experienced or witnessed. The LEC-5 is often used in conjunction with other PTSD assessments to provide a comprehensive evaluation of trauma exposure. The MDQ Mood Disorder Questionnaire is a screening tool used to identify symptoms of bipolar disorder. It assesses mood swings, periods of high energy, and other behaviors associated with bipolar disorder. The MDQ helps determine whether further evaluation for bipolar disorder is necessary and guides the treatment plan. The MSI-BPD, McLean Screening Instrument for Borderline Personality Disorder, is a self-report questionnaire used to screen for borderline personality disorder, BPD. It evaluates symptoms such as emotional instability, impulsive behavior, and unstable relationships. This assessment helps in identifying individuals who may benefit from specialized treatment for BPD, for example, DBT, dialectical behavior therapy. The OCIR, Obsessive Compulsive Inventory Revised, is a self-report measure used to assess the severity and type of obsessive compulsive symptoms. It evaluates behaviors such as checking, washing, hoarding, organizing, and ordering. The OCIR is useful for diagnosing obsessive compulsive disorder, OCD, and tracking the effectiveness of treatment. The PCL-5, PTSD Checklist for DSM-5, is a self-report measure used to assess the presence and severity of PTSD symptoms. It evaluates symptoms such as re-experiencing traumatic events, avoidance, and hyperarousal. The PCL-5 is essential for diagnosing PTSD and monitoring the progress of treatment. The PHQ-9, Patient Health Questionnaire 9, is a widely used screening tool for assessing depression. It evaluates the frequency and severity of depressive symptoms such as low mood, lack of interest, and changes in sleep and appetite. The PHQ-9 is valuable for diagnosing depression and guiding treatment decisions. The PHQ-A, Patient Health Questionnaire for Adolescents, is a version of the PHQ-9 adapted for adolescents. It assesses depressive symptoms in young people and helps identify those who may be at risk for depression. Early detection through the PHQ-A allows for timely intervention and support for adolescents experiencing depression. The PPCS-18 Problematic Pornography Consumption Scale is a self-report measure used to assess problematic pornography use. It evaluates the extent to which pornography consumption interferes with daily life, relationships, and mental health. This assessment helps identify individuals who may need support in managing their pornography use. The PSC-35 Pediatric Symptom Checklist is a screening tool used to identify emotional and behavioral problems in children. It assesses areas such as attention, externalizing behaviors, and internalizing behaviors. The PSC 35 helps in early detection of mental health issues in children, guiding further evaluation and intervention. The PSWQ Penn State Worry Questionnaire is a self-report measure used to assess the tendency to worry excessively. It evaluates the frequency and intensity of worrying, which is a core symptom of generalized anxiety disorder. The PSWQ helps in diagnosing anxiety disorders and guiding treatment strategies. The RSS, Rosenberg Self-Esteem Scale, is a widely used measure of self-esteem. It assesses the client's overall sense of self-worth and self-acceptance. The RSES is valuable for understanding how self-esteem impacts the client's mental health and for developing interventions to improve self-esteem. The SCARED, Screening for Child Anxiety-Related Disorders, Parent Version, is a parent report measure used to screen for anxiety disorders in children. It assesses symptoms of various anxiety disorders, including separation anxiety, social anxiety, and generalized anxiety. The SCARED helps in early identification of anxiety disorders in children, guiding further evaluation and treatment. The SCOFF questionnaire is a brief screening tool used to identify eating disorders. It assesses behaviors and attitudes related to anorexia nervosa and bulimia nervosa. Early detection through the SCOFF allows for timely intervention and treatment of eating disorders. SCOFF is an acronym representing the 5 key questions that make up the assessment. S. Sick. Do you make yourself vomit because you feel uncomfortably full? C. Control. Do you worry you have lost control over how much you eat? 1 stone. Have you recently lost more than 1 stone, approximately 14 pounds or 6.35 kilograms, in a 3-month period? F. Fat. Do you believe yourself to be fat when others say you are too thin? F. Food. Would you say that food dominates your life? The SIS, Social Interaction Anxiety Scale, is a self-report measure used to assess the fear and anxiety associated with social interactions. It evaluates symptoms of social anxiety disorder, helping to identify individuals who may benefit from interventions aimed at reducing social anxiety. The SOGS, South Oaks Gambling Screen, is a screening tool used to identify problematic gambling behaviors. It assesses the impact of gambling on the client's life, including financial, social, and emotional consequences. The SOGS helps in determining the need for further evaluation and treatment of gambling addiction. The TAPS, Tobacco, Alcohol, Prescription Medications, and Other Substance tool, is a screening tool used to assess the use of tobacco, alcohol, prescription medications, and other substances. It helps identify substance use disorders and guide interventions aimed at reducing substance use and promoting recovery. The VADR's NICHQ Vanderbilt Assessment Scale Parent Informant is a parent report measure used to assess ADHD symptoms in children. It evaluates behaviors related to inattention, hyperactivity, and impulsivity, as well as academic and social functioning. The VADRS helps in diagnosing ADHD and developing appropriate treatment plans for children. The World Health Organization's Disability Assessment Schedule 2.0 is a comprehensive assessment tool used to measure disability and functioning across various domains, including cognition, mobility, self-care, and social interaction. It helps in understanding the impact of mental and physical health conditions on the client's daily life, guiding treatment and support plans to improve overall functioning. Each of these assessments plays a critical role in the therapeutic process and provides me a detailed understanding of your symptoms, behaviors, and challenges. By reviewing the results of these measurement tools, we can develop and adhere to a treatment plan that is tailored to your specific strengths, needs, and goals, ensuring a comprehensive and effective approach to your mental health care. That concludes this video. Please subscribe to the channel if you don't want to miss out on new content being added daily. In the next video, I'll review the formal assessment and diagnosis process of conducting diagnostic clinical interviews.